Hello and welcome to my YouTube channel. Hope you are all doing well. So as we were discussing about the cost of health insurance in 2023, so here's some important information for you. Employer sponsored coverage. The average deductible for an employer sponsored plan is $2,004 for an individual plan, 3,868 for family coverage. Marketplace plan. For plans purchased through the health insurance marketplace, the average deductible is 825 for single coverage, co-pays and co-insurance. Co-pays and co-insurance. Co-payments and co-insurance are what you put towards health care once you reach your deductible. Co-payment are flat dollar amount, say $25 for a doctor's visit, while co-insurance is percentage of the cost of health care service depending on your plans and the type of care you could owe one or both. Employer sponsored coverage. Average co-payment are $27 for primary care and $44 for specialty care. The average co-insurance rate is 19% for primary care and 20% for specialty care. Marketplace plans. For coverage purchased through the health insurance marketplace, your co-insurance could be 10% to 40% of bill. Out of pocket maximum. The out of pocket maximum is how much you have to pay for covered service during the plan year. Beyond your premiums, after you spend that amount on deductibles, co-payments or insurance, your health plan will cover 100% of your remaining cost. Employer sponsored coverage. For workplace health insurance plans that are compliant with the Affordable Care Act, the out-of-pocket maximum limits for the 2023 plan year are $9,100 for individual plan and $18,200 for a family plan. The average out-of-pocket maximum for employer-sponsored plan was $4,355 in 2022. Marketplace. For the 2023 plan year, the maximum out-of-pocket limit is $9,100 for an individual plan, $18,200 for a family plan. For high deductible health plan, the maximum out-of-pocket limit is $7,500 for single coverage and $15,000 for family coverage. Typical health insurance cost for a single person. So employer sponsored coverage is $7,911. 1,327 is the average employee portion and average deductible and so on. Health insurance marketplace coverage is given. Okay, how to choose the best health insurance? There is no right health insurance plan for everyone. Choosing the right health insurance is highly subjective to the individual based on their health care needs, risk tolerance, financial situation and how they consume health care, said Bruce Baker, benefit strategist with American Exchange. You want to strike a balance between prepaying through premiums for the amount of care you need and limiting your out-of-pocket exposure in the case of high-cost health care event, said Baker. Cheaper plans typically have coverage caps or a very high deductible and maximum out-of-pocket, which can leave you exposed, he said. That being said, for some with low healthcare needs and the ability to cover that higher exposure in the worst case scenario, the cheapest plan can be the best. What effect of the cost of health insurance? Health plan category. When you buy insurance through the health insurance market, you choose between tiers bronze, silver, gold and platinum. Bronze plan have the lowest monthly premium but the higher deductible, making them best for healthy people who want coverage for worst case scenario. On the other hand, end of the spectrum are platinum plans, which have the highest premium but very low deductible. They are best for those with chronic health conditions, while an employer sponsored plan may not go by metal tires. You similarly may have a choice of plan with higher and low cost sharing.